Hey everybody, this is Kristen here at Apperson, and we're really excited for all of you who are joining us today. Probably for most of you, you're just getting started with a busy new school year, so we really thank you for spending some of your valuable time with us today. We have a great presentation planned, and I want to go ahead and get started. I have just a couple of housekeeping things to go through, so while people are still jumping in, let's get that knocked out. So what you see on your screen, it's individualized for everyone, so you can make your windows larger if you want to see a larger slide view. You can minimize any of the windows that are up there. But before you do that, I want to just point out a couple of them. We have some great items for you today just to thank you for joining us. If you'll notice up at the very top right-hand corner, there's a box that's labeled your free trial of Apperson's Evo SEL, and you can enlarge that right inside your screen. We're going to be talking about the DESSA a lot today, which is an award-winning, well, Evo SEL features the DESSA, but it's an award-winning social emotional learning assessment and intervention platform. And we're offering a free 60-day trial for you to jump in, and that's a great next step to learn more, so check that out. Right underneath, there's a box labeled DESSA High School Edition. We're currently in an exciting process of standardizing the DESSA in the high school setting. And if you're a teacher, if you're an out-of-school time provider, maybe even a parent of a high schooler, make sure to check that out. There's a great way in there for you to earn some extra cash for yourself or for your school, so don't miss out on that one. Right underneath, there's a box for Q&A. So during today's presentation, we may answer some questions as we go, but we'll probably save most of them for the very end when we'll do a Q&A session with both of our speakers. And then lastly, down at the very bottom of your screen are your tools. So if you did minimize any of your boxes, you can pop them back open by clicking on those different colored boxes. And one that I know a lot of you are probably going to be interested in is one labeled Certificate of Participation. And this is where you can download your certificate for joining us today. And then lastly, there's a group chat button. If you want to go ahead and try that out, we encourage you to use that to talk to one another during today's session. Just kind of keep it laid back and open, so feel free to use that as we go. So before I get into our speakers, it really helps us if we understand who we have with us today. So we're going to start off with just a quick poll question, and we just want to know what your current role is. So go ahead and take a second to answer that, and then we'll go through and introduce our two speakers for today. It looks like we have a good amount of you guys are counselors, a good portion are teachers, and social workers, administrators, and then several that are other. If you want to type into the group chat what your other position is, we'd love to know what you guys are up to. And we'll go ahead and jump in. Our two speakers for today, we have Mark Kirsch, who is Apperson's Business Development Manager, and we have Mr. David Adams, who is the Director for Social Emotional Learning for Urban Assembly. And both of these guys have a really broad knowledge of SEL, so I'm sure you're going to find both of their presentations really informational. So Mark, I am going to go ahead and hand it off to you first if you want to get us started.
Thanks, Kristen. Today's presentation is going to be a little bit different. It's probably the 8th or 9th webinar we've done this year in our webinar series. For many of you, this may be a recurring theme. You might have attended a few of the presentations earlier in the year. I know one of our other presenters from one of the out-of-school time setting webinars is actually on today's as well, so I hope there's some great questions from her as well. But we're really excited. First, I just want to say, I've been talking with Dave about doing this presentation for quite a while, mainly just because I have been impressed with his work over the years, how outspoken he is about helping kids in a special ed setting, using social emotional learning as a vehicle to, inform and educate. And, he and I have even had pizza together, so we know each other pretty well, I guess. And I've had a chance to hear him just talk from his gut without any notes before. So today should be even better with a full kind of presentation ahead of us. As I said, I'm not going to jump in too much about what the DESSA is. There is an appendix to this presentation. It'll be sent to you afterwards, so look for it either today or tomorrow in an email. So you can look at it yourself. So there's a few slides at the back end that will explain, what is the DESSA Mini, what is the DESSA, what are the strategies that are included, and give you some of those materials if you wanted to share it with your staff. The DESSA, I mentioned DESSA a lot. It's the Devereux Student Strengths Assessment, and it helps us understand the unique social emotional strengths and needs of the student, which really in turn informs how we select strategies and how we improve outcomes. At Apperson, we really believe that, if you know more, you can do more, and that's really important to us to see what some of our customers are doing out in the field and how they use our products. So we're going to talk a little bit today about the review the role of assessment in a special ed context and help you understand some of the advantages of having a strength-based measurement. Question, why do we have scores anyway? DESSA is really important so we can honor a student's strengths as well as identify their needs. We always refer to it as a need for instruction, which we know a lot of special ed children do have, but everyone in a classroom can benefit when we can understand their needs a little bit more and do some things to help them out. Scores are really effective to help us communicate clearly. So it creates that common lens at which we can review a child, communicate to not only their parents but also other staff that are working to help them on a daily basis. And as I mentioned before, choosing an area for intervention is incredibly important with this group. And tracking progress, measuring the outcomes, and improving how we work with them is also very important. We do, again, I want to, explain too that this is, as Kristen said, currently a K through 8 product, and that high school is currently being normed. So just to reiterate that Kristen mentioned, there is a paid pilot that is available if you are a part of a high school program or have high school youth yourself. So please check that out. Continuing on here. So covering a little bit about the DESSA in a tiered approach. For Tier 1, usually it's the DESSA Mini is used at the universal level, helps you produce a classroom profile, and can really help you understand who might need additional assessment. The DESSA Mini is, really a quick, valid, reliable tool used to get a basic understanding. Does that child have an area of strength? Are they in an area of need, or are they in the typical range? Which can really help you kind of better understand your kids. If you are doing, that full DESSA just to kind of understand where they are, it does give you quite a bit of information in your classroom to identify common areas of strength or concern, and can lead to some classroom strategies that you can implement, as well as, on a universal level, looking at foundational practices that can help support SEL environment. And again, those are some of the things that are in the appendix and explain a little bit better what those include. As for Tier 2, we look at, assessing the at-risk children so that you can go more of a one-to-one intervention basis. And as a part of our system, that 72-item DESSA provides full descriptions across the 8 social emotional competencies that we measure, and can really be great to help you build individual child profiles and work on a targeted basis with individual one-on-one strategies, small groups, take-home strategies, and really just help improve your practice, as we said before, is one of the main goals of the system and platform. Lastly, which I think most of what we're talking about today is the Tier 3, looking at how we can identify important strengths that can be incorporated into IEPs and leveraged into practice. And one of the things that really stands out from my time spent with David has been his sharing with me the importance of looking at these children. And you know what? It's very likely that they may have needs across the board. They may have needs across every one of those competencies, whether it's optimistic thinking or their goal-directed behaviors. But what you can do is look at, all right, which one of them are they the strongest in? How can you leverage that to work with them? What are some of these areas of strengths that can be used to kind of, raise the tide on the rest of their areas of need and help kind of communicate in a really easy, seamless way with everyone that does provide assistance with that child. So another reason why I always love talking, every chance I get, talking to Dave about his approach and what he does in his schools. Keep going here. Last of my slides, really just looking at the way that the DESSA does add value. It meets a lot of requirements in states that have social emotional learning standards. Your states that you're working in may just be starting. You might be kind of at the tip looking at it, especially with the ESSA coming along, and the DESSA is a great way to look at those additional skills that are really closely related to academics and discipline, but can really help tie it all together. We support implementation of SEL and other similar programs, so it works really closely if you're already doing a universal curricula in your schools. You can use the DESSA and the included intervention strategies to add value and to add more of a just-in-time approach to interventions versus some of those universal curricula. So it adds value there, and really meets requirements on doing strength-based assessment, especially with the IEPs, which is incredibly important when we're looking at understanding some of the special needs that these children face every day. So with that, Dave, I will kick it over to you. And again, very excited to have you here. As you have any questions, the group can put them in the question box. I'll try to keep up with them, or we'll answer them at the end. Thank you.
Great, Mark. Thank you very much. So as Mark alluded to, we're going to be talking about applying the DESSA to a special education context. I'm David Adams, Director of Social Emotional Learning at the Urban Assembly in New York City. So we have some objectives over here. Our first objective is for participants to understand the role of assessment in a special education context. The second is to understand the advantage of a strength-based assessment for progress monitoring. So what I wanted to think about here, and we're going to take about a minute or two, and you guys can type into the team chat, is this essential question on how would special education outcomes be different if we used effective assessments of social and emotional competence. All right, so take a second. We're going to give you guys about 2 minutes. In your team chat, just think about how do you feel like your outcomes in special education would be different if we used more effective measures of social and emotional competence. So we have some comments coming through. We're looking at the ability to quantify and track social and emotional concepts, which is something we're going to be talking about. We're going to talk about language. Audrey's talking about the idea of looking at assets rather than deficits. So we're going to be thinking about that as well. So let's take about 1 more minute and have some other people think about their current practice and how it would be different if they used effective measures of social and emotional competence. All right, so taking off of some of the comments here, right, some of the things that you guys have talked about are some things that we're really going to be focusing on. Stephanie talked about this idea of accurate and tailored measures to the skill level of the population. staff will be on the same page. We're going to talk about language. So all the things that you guys have talked about, hopefully we're going to be covering in this quick overview of using the DESSA in the special education context. Quick background, I started my career at the Center for Social Emotional Learning and Education in New York City. Moved over to the Yale Health, Emotion, and Behavior Laboratory. Spent 5 years in District 75 in New York City. And I'm currently at my third year as Director of Social Emotional Learning for the Urban Assembly. So the first thing I want to talk about when we talk about social emotional learning is I want to just go through the definition of emotional disturbance as articulated through IDEA, because the classification of emotional disturbance is often one that we can relate to in terms of working with the more challenging behaviors in special education. Many of our students do not have a classification of emotional disturbance. They may demonstrate these behaviors that take away from learning. Some of our students have a classification of other things like other health impaired or learning disability that's comorbid with some challenges that are also put under the emotional disturbance lens. So according to IDEA, students classified with emotional disturbance, if they have an inability to learn, cannot be explained by intellectually, sensory, or health factors. If they have an inability to build or maintain satisfactory interpersonal relationships with peers and adults, inappropriate types of behaviors or feelings under normal circumstances, or general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. So essentially, the category of emotional disturbance is this catch-all for anything that has to do with behavior that is also not linked to or not explained by intellectual, sensory, or health factors. And we're going to talk about how the social emotional learning approach can help address these needs, which for students classified as emotional disturbance, but also for students across your school who may have challenges in terms of the social emotional realm, but who may not have a classification at the moment. So a quick slide to get a sense of who our students are who are classified as emotionally disturbed. You'll see they're about 5% of the special education population, but it's also important to note, right, that just because you have students who are classified as emotionally disturbed as their primary special education classification, we do know that behavioral and social emotional challenges are comorbid with a lot of other challenges that we see in special education. For example, we know that students with emotional disturbance often also have speech and language impairments. And the chicken and the egg question is a one that we can think about with regards to whether or not language impairments develop social emotional challenges or social emotional challenges are the result of language impairments. We know that students with learning disabilities often have concurrent challenges with behavior in the classroom. We know that other health impairment is a very popular category for parents who don't want their students classified under a specific area of need, but may also have challenges in terms of the social emotional domain. Lastly, we know that students with autism, students with hearing impairment, students with intellectual disabilities often also have challenges in the social emotional domain that may not get a categorization of emotional disturbance, but may need to think about how our social emotional supports in our schools are helping those students to be successful. Drilling into the category of emotional disturbance, we do know, based on that specific category, that students with classified as emotional disturbance are more likely than any other group to be economically disadvantaged. They're more likely to be male, and they're more likely to be from single-parent households. So it's important to recognize when we're thinking about our student populations, not every kid gets this classification, but many of our students fit this demographic and often have attendant behavioral and social emotional challenges based on the demographics that they're looking at. Further on, and this is the slide that is important to me, that students classified as ED have the worst prognosis in terms of high school graduation, academic achievement, and future problems with antisocial behavior. So these are the children or students in our schools who we're thinking are going to be the most challenging students in terms of working with and in terms of academic and social emotional outcomes that impact not only the school but society at large. Taking a second to look at this slide, we've highlighted in this slide some of the challenges that we see for students classified as emotionally disturbed. When we look at Table 1, the table is the table of average numbers of credits earned by disability category. We look at the top line, we see the disability categories as per special education and IDEA, learning disability, speech and language impairment, mental retardation, which is now intellectual disability, emotional disturbance, hearing impairment, visual impairment, orthopedic impairment, other health impairment, autism, traumatic brain injury, multiple disabilities, and deaf blindness. When we're looking at the number of credits they're earning in a high school context, what we're seeing is that students classified as emotionally disturbed have the lowest number of average credits earned out of any other category of students. And to me, when we think about that, that's really a call for re-examining the work that we're doing with these students and whether or not it's being effective. If we're looking at, for example, academic courses at 10.5 versus academic courses for students with intellectual disabilities and the credits that they're earning at 10.6, essentially what we're saying is that a student who does not have a specific intellectual disability but whose primary area of need is based on their social and emotional competence has less of a chance of earning credits than a student who has an intellectual disability that's functioning and that's impairing their cognitive ability and their ability to actually learn the materials that we're putting. So this slide, for me, is one of the call to Jesus' moments, where we really need to stop and think about how are we approaching students who are classified as emotionally disturbed, what supports are we putting in place, and how are we using assessment to make sure that the work that we're doing is producing outcomes that are measurable and impacting the student's academic achievement. So where did we go wrong? Given that it seems as if our interventions in other special education classifications are working better than our interventions for students as classified as emotionally disturbed, what are some areas of needs that we've identified through the literature that are impacting our students' ability to do well? The first thing that we want to think about with regards to our intervention is that typically our interventions lack intensity. That means the focus of the interventions is not clear. And so when we're looking at identifying what is the area of remuneration around the student's social and emotional need, often that need changes from counseling session to counseling session, or that need is not clear from the counselor to the teacher to other environments in the context that the student is learning in. So the first thing we want to think about when we're looking at assessment for social and emotional learning in the special education context is making sure that we've identified a specific area of need and focusing on that specific area of need for a period of time. The second piece, as we've talked about before, is this idea of a lack of duration. So given the intensity of the needs for students classified as emotionally disturbed in our special education settings, the amount of time that we are spending on a specific area of need that should change the behavior that we're looking for the student to change is not the amount of time that we're doing. So when we're looking at duration, we need to think about how long are we spending on a specific area of need before we assume or we are assuming that a behavior change is likely in the context that we want to see it in, which is the classroom. The next area of need that we've identified with regards to working with students classified as emotional disturbance is haphazard identification of areas in need of remediation. Many a time when we're looking at the IEP status of students classified in this category, we see that the same IEP goal has been listed for 3 to 4 years. We see lack of effective progress monitoring on that goal, and it's difficult for us to understand how that goal directly impacts the student's ability to be successful in the classroom. Typically speaking, we see many times our counselors or our school psychologists are the driving force in identifying that goal rather than the people who need to work with that student in the classroom. The last thing we want to talk about here is lack of generalization, especially when we're looking at students with emotional disturbance, classified emotional disturbance. We see that the skills that they're working on are not necessarily generalized into the area in which they need to perform those skills. So many times working with counselors, working with social workers in the schools, their feedback is that the student is doing a lot better with me, that the student is verbalizing with me, that the student and I have developed a relationship that is being effective, but none of those skills or none of those supports have been generalized into the actual classroom setting where teachers are recognizing the shift in student behavior. So focusing on this idea of generalization, one of the questions that we want to think about is how do clinicians and educators develop a common language from which to support student social and emotional development? One of the biggest challenges that we see in schools is there's a gap between how clinicians are viewing behavior, how teachers are viewing behavior. And that gap is driven by a gap around language, and we're going to talk about the use of clinical language versus the use of skill-based language, and also training and background. So one of the things that we want to think about is how do we align what students should know, which are understood as standards, through the process of teaching and learning to develop students' understanding of those standards, which is developed through curriculum, and checking for the behaviors that reflect student understanding, which is assessment. So the big idea we want to take away from this is in order for students to make gains around their social and emotional development, they need to have clear standards of what they should know. They need to have clear ways of teaching those standards to those students, and we have to have clear ways of assessing that those standards are being taught and that the student is reflecting those standards in their behavior. So, thinking about language, we want to think about how do we describe behavior in schools. So in my experience, essentially we have three tribes of behavior explanation in schools. The first tribe is going to be the clinical language. Right? Clinical language is usually spoken by the mental health tribe, which is school social workers, guidance counselors, clinical psychologists, to a certain extent school psychologists, etc. This language is typically DSM focused, and it's a symptomology based on classification. So in this tribe, what we see is discussions of whether or not a student should be classified with intermittent explosive disorder or whether or not they should be classified as impulse control disorder, right? There's a focus on classification, and there's a focus on making sure that the classification is supported by the symptomology of the behavior. Some of the challenges that we see in terms of clinical language is, number one, it's almost always focused on deficits, right? Clinical language in and of itself is designed to demonstrate how a student has diverted clinically from the typical population. So when we look at a student and we classify him using clinical language, we identify their deficits, and then we also assume that that clinical language leads directly to an intervention that's school-based, right? So when we look at the clinical language and we decide that a student, based on outside evaluation, has intermittent explosive disorder, that classification does not necessarily lead to an intervention that's school-based and that the teacher can work on in order to make that to help that student develop. The other challenge with our clinical language is that it's often focused on what the student is versus what the student does, right? So we know that the student is performing behaviors, and with clinical language, we tend to then internalize those behaviors and generalize them to the student themselves. This student is bipolar. This student has intermittent explosive disorder. This student has conduct disorder, rather than focus on the skills and attitudes and behaviors that we need to focus on in order to move that student along their developmental pathway. The second language that we speak in school is behavior analysis. This language is typically spoken by the behaviorist tribe, popularized by school psychologists, behaviorists, PBS specialists, as well as special educators, right? This tribe focuses on function-based analysis, specifically looking at how the students' need, their environmental inputs, and behavioral outputs intersect to increase, decrease, or maintain the behavior. So in this version of the way that we look at behavior, we're focusing very deeply on how the environment is structured in order to produce, maintain, or decrease specific behaviors that we want the students to focus on. Some strengths of this approach is that it's teacher-friendly, right? So we see that many districts have hired behaviorists or used a behaviorist approach because there's a very specific intervention that can be taken from the analysis that this approach looks at. Looking and identifying the function of behavior leads to specific interventions for our kids and allowing our teachers to import and engage in those interventions in the classroom. Some of the challenges in terms of the behavior analysis is that all of typically the functions of the behavior tend to focus on things like avoidance and tend to focus on things like attention, but tend to not necessarily incorporate concepts like attitudes and values. and how students feel about a certain situation, and understanding how those skill sets are reflected in the work that they're doing. The last tribe or language spoken by behavior is social emotional learning, which is spoken by teachers, psychologists, mental health tribe altogether. This area is focused on a developmental support that thinks about attitudes, skills, and values, and develops social and emotional competence within the classroom. There's a common language and definition across schools. So the argument that we're going to be making today with regards to using social and emotional learning as a frame to understand behavior in the classroom across all settings is that by creating a common language with regards to a student's social and emotional competence, right, we're focusing on a strength-based approach that doesn't necessarily have to wait for a student to demonstrate a negative behavior before we are demonstrating or we are intervening and supporting that student with regards to their social and emotional development. So before we get on, we want to quickly define social emotional learning as the process by which children and adults develop the skills, attitudes, and values necessary to understand and manage life tasks, such as cognitive learning, forming relationships, and the flexibility to adapt to challenges and expectations of a complex society. So essentially, when we think about social and emotional learning, it's the cognitive, the social, and emotional skills that students and adults need to be successful and to demonstrate social competence in society. This is the core competencies based on CASEL's framework, focusing on self-management, social awareness, relationship skills, self-awareness, and responsible decision-making. When we look at the DESSA, it's important to note that there is an alignment between the CASEL skills, the curriculum that's taught based on these skills, and the assessment, which is the DESSA, that assesses these skills. So there's an integration and alignment between our standards, our curriculum, and our assessment that will allow us to have an integrated model of social and emotional learning that bridges some of these language gaps that we've identified in the slides before. So although we started out focusing on emotional disturbance as one of the areas that we needed to think about with regards to our interventions around social emotional development, it's important to know that many categories in special education often have challenges in social emotional learning, right? We have ASD, autism spectrum disorder, and some examples of some assessments that give us understanding of adaptive functioning and social skills development. We have intellectual disabilities, which looks at, again, adaptive functioning, social skills development, as well as emotional disturbance, looking at the student skills inventory, the BASC, the pediatric checklist, the BEARS-2, the child behavior checklist, all of which are focused on understanding the student's social and emotional strengths and challenges. As we get to the DESSA, one of the critiques of these measures is that each of these measures tend to be specific to the disability that they're measuring, and many of these measures are used for classification of students as emotional disturbed or not, or whether or not they're on an autistic spectrum, rather than giving feedback around a student's strengths and challenges and allowing that feedback to be used to make progress on that area of need. Additionally, when we look at the measures that we've identified here, there's no corresponding curricula that is whole school that allows us to look at these measures and think about how can we take a whole school approach to address these areas of need for all of our students and enhance competency, rather than having to look at a specific student and looking at their specific strengths and challenges in isolation of the rest of the context of the school. So as we talk about the DESSA, we're going to be talking about very clearly one of its strengths is its ability to use the same framework that is aligned to curriculum that all students can access, as well as special education students can access, particularly for those who are classified as emotional or behavioral disturbed, in order to make progress on their social emotional competencies in a context of whole school intervention. So quickly I want to talk about, within that idea of whole school intervention, what is important to think about with regards to strength-based assessment. And the title of this slide is going back to this idea of what a child is versus what a child does, right? And to get to this point, we want to take a quick a quick story. So I was sitting in a PPT meeting where we look at our high-need students in the general education context. There was a young woman we were talking about in that meeting who was classified as emotional disturbed. We had a teacher, a guidance counselor, and a school psychologist present in that meeting. We were thinking about what are we going to be working on in terms of this student who's causing a lot of challenges in the school. The school psychologist came to the meeting and said, we've classified this student, we tested the student, and this student is classified as emotional disturbed. And we said, okay, great. So we know that she has challenges, right? And those challenges are probably outside of the normal range of challenges with regards to social emotional functioning. What are we going to do to address those challenges? The school psychologist said, I told you, we classified her as emotionally disturbed. And so we went around the table and thought about, like, what are some challenges or what are some approaches or problem solving in order to address the student's needs? And the school psychologist got more and more frustrated because she told us that she had worked with the student, she had classified the student as emotionally disturbed, and there's nothing we can do for the student because we had classified her as emotionally disturbed, right? So it's really important to recognize when we're looking at assessment and looking at labeling and classification that there's a difference between what a student is and what a student does. And when we use strength-based assessment, it gives us an opportunity for all students, first of all, to receive feedback on their social and emotional competency without the need for classification. A strength-based assessment can be given to the whole school for all students to think about what do I do well in and what do I need help in. Next, it identifies the replacement behavior and competency and refocuses interventions on those competencies, on those interventions while increasing those competencies. So a strength-based assessment says, what is it that the student should be doing? What typifies effective functioning in this area? As opposed to saying, what typifies atypical functioning in this area, right? So when we look at interventions or we look at assessments that ask whether or not the child has harmed animals, for example, which is a really good predictor for a psychiatric diagnosis, it doesn't then give us an opportunity to think about what should we be doing with regards to interventions. Whereas when we use a strength-based approach and we ask whether or not the child can develop effective relationships, and our answer to that is no or sometimes or maybe, right, it gives us an opportunity to think about intervening directly on the child's abilities to form relationships as a way to develop support for that child. And lastly, it reminds us that students have strengths and challenges and can help guide our intervention. Right? When we label kids, we often use the label to describe the child rather than using that child's strengths and challenges. Every child has a strength and a challenge. And it may not be a normative strength or a normative challenge when that is compared to the whole population, but every child does something a little better than they do other things. When we look at a spectrum of social and emotional competencies through a tool like the DESSA, it reminds us that they're not just their disability, and they're not just their challenges. They do things well, and we need to be cognizant of how we intervene through their strengths in order to address their areas of need. So going back to our areas of how we can be improving the work that we are doing with regards to assessing students in special education using the DESSA, the first idea, the first strength of the DESSA is that we're going to be assessing students using teachers, right? So the first thing that does is it makes social emotional learning the realm of the entire school, not just the realm of the school psychologist or the guidance counselor or the school social worker. When teachers have an opportunity to start to look through the frame of social emotional competency and understanding their students' strengths and challenges, we've already enlisted the help of 90% of the staff in that school, being the teachers, because they're now looking at students through the frame of what did they do well and what are some challenges. So step one is to really make sure that we're taking the assessment functioning, particularly at the subclinical level, outside of the hands of the mental health specialists in the school, and giving it to the teachers so that teachers understand what are the things that we're working on in counseling or through social emotional curricula, and then what's their role in that in helping that student to function. The second is to focus on a specific competency or domain. So assuming that we're working with students in counseling or in a small one-to-one or one-to-three setting, right, we need to be thinking about what is it that we're working on. All of the social emotional competencies are intertwined, but when working with the kid, we want to specify that we are going to be thinking about relationship skills or decision-making skills Or we're going to be thinking about the student's ability to label and express their emotions effectively with the context of self-awareness skills. Or let's say we have that ready to go. We really are thinking about having the student self-manage their behavior effectively, right, by using coping techniques. When we think about a specific competency or domain, we can articulate that back to the teacher. And if the teacher or the school is using a social and emotional framework or curriculum, this gives them an ability to think about how they're working in the classroom with that student on that area of need, and gives us an ability to benchmark our progress over time. Next, we create a shared focus. In the schools that we worked with in the DESSA, essentially, after the teacher assesses the student, the guidance counselor or social worker sits with the teacher, particularly if they've come up on multiple areas of need, and thinks about a shared area of focus that's going to go through counseling to the classroom, right? So if generalization is an area of need and with regards to our effectiveness in working with specifically students classified as emotional and behavioral disturbed, it lends the idea that if we need to create a shared focus on a behavior so that that generalization, the intensity of the intervention increases, and that multiple people are working on a similar area of need for that child. Next, we need to invest enough time to see growth and progress monitor. When we work through this, typically speaking, our benchmarks were every 6 weeks, where we benchmarked our students with regards to assessing their growth around our social and emotional competencies through their IEPs. This is in the context of a student who has an IEP, and we're looking at whether or not they've made enough growth in order to, on a specific competency or a cluster of competencies, indicators in that competency, in order to move on to another area of need or to move on to an area within that competency. And the last area is provide time to understand the skill and to practice the skill. The idea of practicing social and emotional competencies as opposed to thinking about social and emotional competencies is a really important idea with regards to how students internalize skills. The more time that they have to practice the skill that's specific and delineated through the assessment of the DESSA that we've established, the more likely the student is to be able to practice that skill under conditions of stress or emotionality. If we just talk about skills and students talk about skills with us, right, that means that the student can have a conceptual understanding of the skill, but most of these skills are related to behaviors. And so when the student practices a behavior on a consistent basis, that maximizes the ability of the student to perform that behavior in the context of counseling, in the context of the classroom, and in the context of after-school programs or in the community. So that is a quick overview of the way that we think about the Devereux Student Strengths Assessment with regards to applying it to the special education context. Some quick questions that we want to think about is how does this overlap with already going into your schools? How is this different? And what will we do when we get back to schools? So for the next 15 minutes or so, we're going to open it up to questions. And you can type in your questions into the group chat, and we'll take those questions in and be able to answer them with regards to what we've talked about today.
Thanks a lot, Dave. I'm actually surprised not a lot of questions during the presentation, which means you've covered a great deal. So I do really appreciate that. Folks, if you do have any questions, just click on the Q&A tab. Is probably the easiest one, and they'll come in, and we'll field them to the group. We'll stay on for a few minutes if we don't get any questions, and wait to see if you have anything.
And really quickly, while you guys are thinking of those questions, I just wanted to reiterate that we are going to be sending out the slide deck, so feel free to share that or review that on your own time. And in addition to that, we'll be sending out links to all of the offers we have and some additional resources that will be really good for you to use.
Well, I am not seeing, oh, there's one. All right, good. Have you worked with any schools, Dave, that partner with the out-of-school time providers, and both of you guys use the DESSA?
So we've worked with schools now where the after-school provider, most of our middle schools in New York City have an after-school provider. and it's been a challenge in a larger sense in standardizing the approach that the school takes to behavioral supports and social emotional development, and the after-school provider takes to social emotional development and behavior supports. So we do work in schools that use the DESSA, but the after-school provider may not use the DESSA, and I think there's a larger challenge beyond the specific measures and approaches to getting to a common sense of how students will be worked with during the school day and after school, based on philosophies of the after-school provider, based on philosophies of the schools, and things like that.
Okay, thank you, Dave. See if we can get any other. Oh, here's another one. We got a question. Just someone asked, is the assessment something a school would have to purchase? And if so, how much would it cost? Pricing really does vary based on whether or not you buy kind of the full package, which includes the intervention strategies and everything. We do typically sell on a per student pricing basis, and it's something that we'll be happy to take care of, kind of talking with you, one-on-one. It's something we can discuss, but absolutely, it's something that we try to make it as affordable as possible while also providing a lot of different options. Really, it's based on the needs that you guys have specifically. Can you recommend books to help with recommendations of classroom or therapeutic based on viewing behaviors from positive behavior supports?
I think one of the good ones is Ross Green's book. I think the most important thing that we can do is give feedback to teachers with regards to their practice. So specifically in District 75, we work to combine the SEL approach to the positive behavioral supports approach, where we considered PBIS the environment that sustained effective social and emotional practice, right? So that if we were developing social and emotional skills, what we identified, reinforced, created expectations within the context of PBIS helped create the environment in which those social and emotional skills would be the most likely skills in order to achieve the student's needs. So I think the key in terms of looking at this piece is really going through and identifying which curriculums meet your needs the best, and then using a PBIS approach or a behavioral approach that makes sure that these behaviors are the predominant behaviors or the most likely gateway in order to achieve the student's needs.
Thanks, Dave. This question's a little bit longer, and I don't know, maybe you can read while I'm going just to make sure you capture it. But it talks about planning or working with kids includes an individualized approach. How do you go about selecting an area of focus for a child? Do you typically select the area of greatest need, or select based upon one you think will be most impactful? And I know this is a kind of an important topic to you, Dave, because I know a lot of your other work that you do surrounds kind of effectiveness of your interventions. But how do you want to answer that one?
Yeah, I think so. The way that we're looking at it now, and Mark and I have been talking about developing more sophisticated approach to this piece, is we look at the top 3 areas in which the student is performing in, either normatively, which is compared to the rest of the population, or relatively, which is just compared to the student. And then we look at the bottom 3 areas that the student is performing in. And from the bottom 3 areas, we choose the competency that is having the most impact on the student's ability to learn. And that's where the guidance counselor, social worker, and the teacher sit together. So let's say we're looking at optimistic thinking, relationship skills, and self-management with regards to their bottom 3 areas. We would then come in together and we use a protocol, and we decide out of these 3 areas, if the student would develop the skills, in which domain do you feel like they would be able to best access classroom instruction? Based on that, we choose a domain of functioning, and then we look in that domain at some of the indicators that create that domain. And again, we think about choosing 3 items that would best help the student within that domain function in the classroom setting We'll use those 3 items to benchmark with regards to their IEPs, and then we start to think about 6-week kind of progress monitorings in terms of their ability to make progress on those areas of need. We are in the process of working with Apperson and Mark at establishing some more statistically savvy approaches that would allow students individual profiles to predict which areas of which items on the DESSA they would be most sensitive to in terms of change. So when we get that system up and running, essentially we'd be able to look at a small number of items based on each individual profile that would best predict the student's growth.
Thanks, Dave. And again, that's a lot, we got a lot of work to do there. That's not something I know. I know who's asking the question. That's not something we have available tomorrow, but it is a really interesting idea. And I know a lot of our folks who are currently using the DESSA, they go to what is essentially page 3 on an individual report for a child, and it does go into the individual item breakdown, and it tells you, was the answer that was marked, is it a is it a need? Is it a typical answer? Or is it a strength for that child down to the individual item? So it does allow you to dig in and maybe even just, talk to your teachers about focusing on a couple of things at a time and figuring out, maybe you have your own approaches that you want to take. But great answer. I really appreciate that. Dave, there's another question asked about, you talked about benchmarking every 6 weeks. And they're asking, do you use your own tools to benchmark, or are you using the DESSA every 6 weeks?
So with the 6-week cycles, essentially what we're looking at is the students operating within that domain. So if we look at the relationship skills as our area of need, and then let's say we are going to look at the eight indicators that make up relationship skills. In the 6-week cycle, what we would do is we would have the teacher just look at those indicators within that domain in order to demonstrate whether or not that student has made growth. So we would pull out those items from the DESSA and give the teacher those items within that area of need, and ask the teacher to just rate the student again. And then the clinician is going to be thinking about whether or not the growth in that is sufficient enough in order to move on to areas, different domains, or whether or not to stay on that domain. So we're sticking with the DESSA. We're just pulling out the items within the domain that reflects the areas of need that the clinician and the teacher have worked together to establish.
And again, I'll add that, Dave's doing a little bit of a deeper approach that's looking at some individual item analysis. So part of his work includes a little bit different approach than some of you might take. As for the recommendation for the DESSA, you have to know the child for at least 4 weeks before conducting a rating. And usually people match that up based on their marking periods. So, you can do it pretty much as frequently as 4 weeks, but it's not typically recommended to do it every 4 weeks. Spacing it out does give you obviously more time to observe the behaviors. Another question, are there any inter-visitations possibly available with schools using the DESSA? I'm not sure, you might be asking if you can visit a school that's using the DESSA, and that probably would be based on whether or not they were close by one of them that does it. But that's something that I'll follow up separately with the person who asked that question, because we have a core group of our customers that are really some great kind of benchmark sites. We really are excited about what they're doing. They follow a really great implementation plan. And we typically tend to recommend, if there's one that's close to you, that you can have a conversation or meet with them. I know one of my personal goals is to start a learning community soon that would share some of the common knowledge amongst the group, and we're hoping to start some of those things in the near future. It's a little bit of an undertaking, but we're excited about trying to do some of those things as well. I think we're coming up on time. I know some folks are having to leave. I saw some thank yous that people have said this is a great and interesting presentation and product. but they have to leave school because it's closing. So again, really appreciate the time that you've spent, everyone. Thank you for taking the time out of your day. I know it's kind of a grueling schedule for most of you right now. So thank you again. Dave, as always, I appreciate your insights and how you present. You always inspire me and keep me moving with what I do and what I do on a daily basis. So thank you, and thanks for making time to present with us. And I think on that note, we'll end the call today, and we will follow up with people shortly. Enjoy the rest of your day.